For Data Lab Challenge 3, we got the project to determine the coronavirus outbreak peak in number of cases in the USA. We proposed to use maximum likelihood estimation combined with polynomial regression to accurate the prediction. Also, we will look at the maximum capacity of the healthcare system to check whether more hospitals will be needed to meet the peak or not. We have divided the whole project into 4 sections. In section 1, we will be discussing a little bit about the COVID-19. There will be some statistical data analysis on section 2. In section 3, we will show some COVID-19 modeling and at last the prevention and conclusion. COVID-19 is caused by a coronavirus called SARS-CoV-2. It is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. Infected people have had a wide range of symptoms from mild symptoms to severe illness. They may have cough or breathing problem with fever, muscle pain or headache. But the emergency warning signs are trouble breathing, persistent pain or pressure in the chest, inability to arouse, bluish lips or face. Research suggested that up to 25% of those who become infected with the coronavirus may not show any symptoms but still can spread the virus. In that case, wearing a mask in public places is the only way to stop the transmission of the deadly virus. This is the map showing the COVID-19 outbreak scenario. More than 200 countries around the world have reported a total of about 3 million confirmed cases and of 230K total deaths. United States, Spain, Italy, France, and United Kingdom are now the top 5 countries struggling with the virus. This is the scenario of the USA. Experts say that numbers don't give the whole picture because many cases, including mild or asymptomatic infections, have not been diagnosed. The outbreak in this country, which now has the highest number of known cases in the world, is exceeds 1 million with a death toll of more than 60,000. New York has become the epicenter of the country's outbreak with near about 30,000 confirmed cases and 2,300 deaths so far. Massachusetts, Illinois are states have had high growth in reported cases and deaths. The good news is, in some states like New Jersey, Florida, Louisiana, Connecticut, the new number of cases are now decreasing. This is the breakdown of how the coronavirus affects people of different ages in the USA. Americans ages 65 and older are suffering the highest rates of death and serious illness from the coronavirus, according to a report from the CDC. Over 85 make up the largest portion of coronavirus cases, which is above 10% of death rate in the USA. Although older people are hardest hit, young people are not spared. Data from many countries clearly show that people under 50 make up a significant proportion of patients requiring hospitalization.
In this project, we wanted to model the COVID-19 virus outbreak and determine the maximum number of cases that would happen in our country. To do this, I began by downloading and cleaning the data and putting it into lists to be analyzed. Then I calculated a regression on the data for Chittenden County, for the state of Vermont, and for the country as a whole, and plotted the data and its regression. I also looked up some data on the spread of COVID-19 in England for comparison. In addition, I looked at performing some different kinds of regression on the data to try to get a better fit. The fourth degree polynomial regression seemed to fit best for the data in the US, as can be seen in this slide. In England, the third degree polynomial fit best, as can be seen here. As you can see in the graphs, there are multiple peaks in the number of new cases. This is probably due to a number of factors, including different states handling the situation differently, people going back to work too early, different places being at different stages of the outbreak, and the possibility of different strains emerging. We also looked at modeling the spread of the virus. We know that slowing the spread of the virus is key to reducing the number of cases and the number of deaths. I modified the code on the Epidemics on Networks website and used the NetworkX Barabasi-Albert graph to show a heterogeneous mean field approximation for the number of cases with different transmission rates. In this graph, you can see how the influence of the virus is contained by slowing its spread. I include a line to show how the capacity of the healthcare system limits the number of people that can be treated, and that slowing the spread enables more patients to get life-saving care.
I am interested in building a machine learning model to predict the peak of the outbreak based on the cumulative confirmed case. And I start with a polynomial model. And I found as the degrees increased, the curve fits the whole data set more well. But when the degree larger than 4, the curve start goes down, which doesn't make any sense because the y-axis is a cumulative confirmed case. There's no way to make that goes down. So I switched to a logistic model, and the logistic model has been widely used to describe the growth of a population, and an infection can be described as the growth of the population of pathogen agent. So I think a logistic model seems like more reasonable than polynomial model in this case. And the the x in this formula is the time, like how many days, and A refers to the infection speed. B is a day with the maximum infections occurred. C is the total number of the infected people at the infection's end. And here I plot the logistic model based on the data from the CDC, and the blue dot is the measured data, and the purple line is the predicted data. And roughly, I think the peak is around at the day 120, and if you do the math, I think it's it's around May 20th. So um, here's what I found. Uh, since every day there's new data comes out, and you can always put that new data into your data set, but I don't try to plot every single updates. But here's what I found. uh, Based on the new data comes in every day, I always got different parameters value, the parameters of this logistic model. And although this model seems to be the most reasonable one for me, but the shape of the curve will probably change due to some unpredicted effects, like such as some government actions, like some states open the beach, open the restaurant, so that might be in fact the final shape of this curve.
Hi, I'm Joshua Powers, and I just wanted to show a little bit of the simple data analysis we can do with an interactive graph that we created. So here we have a graph where we can look at the COVID-19 data for all the different states, or for the US as a whole. We can shift the scale to be a log-log scale to get a better idea of its type of growth, whether it's exponential or not. And we can also fit a polynomial to it to get an idea of the manner of growth of the virus as well. We can also shift this to make it a degree 1 polynomial, which would just give us a linear fit and give us the average increase in slope, which can be useful on a log-log scale. Also interesting using this data is we can look at different states and see how they differ from the United States as a whole. So for instance, we could look at some of these states and maybe see that their curves are very different, or we could even see that perhaps the way they don't count every day. And so we can see something like Vermont, which seems to be leveling out, or even New York seems to be looking like it's about to start leveling out, versus maybe something like California or the US as a whole, which seem to be increasing, and just give a motivation for different policies taking place in different states and looking at possible reasons why the growth might be different, and why we should approach policy decisions differently in different states with COVID-19.
So to wrap things up, we'll talk about how to prevent COVID from even spreading in the first place. So before we do that, we should briefly talk about the current hospital situation in the United States. As it stands, specifically, we're short about almost 9,000 ICU beds. And then on the whole, regular beds, so non-ICU patients, we're short about 2,900. And so that really speaks to the severity of this disease, and that the patients that are being hospitalized with COVID are critically ill. These aren't normal inpatients that you're seeing. They're critically ill, and furthermore, the amount of ventilators we need, 19,481, speaks to that as well. And so with that, on a slightly different note, the impact of social distancing is key. We don't have a vaccine. We're not going to for at least a year. And so until then, right now, what is going to be the best thing for us is to be able to practice social distancing responsibly. And it's not going to be easy, but it's what we're going to have to do. And so just briefly, the first graphic that we have here, again, just drives home the severity of the coronavirus, that this truly is a pandemic. You look at the seasonal flu on the right, which it was frequently compared to before we knew how bad this was. And then on the left, you have COVID, and it really just shows you that the R naught, or the infection ability of this virus, is quite high. And then all the way on the right, in the separate image, is a little more hopeful, in that we can do something. We can make a big difference. And sometimes, in this case, it's just not going out as much or doing it in a mindful way, which brings us to our almost last slide here. And so thinking back to that previous slide with kind of stopping the virus where it stands, we can do that in a variety of ways. It's similar to any other flu, washing your hands, keeping around 6 feet from other people, not touching your eyes, your face, no matter how tempting or how badly you have an itch. Cover your mouth, please. That's kind of already done for you with a mask, but you should still do it. And then, just listen to what's going on. Be aware, be informed. And so, lastly, thank you for listening, and stay safe and healthy.